So, what is clinical governance?
According to the Department of Health, clinical governance is a system through which organizations are accountable for continuously improving the quality of their services and safeguarding high standards of care.
How is this done?
The Department of Health states that this is achieved by creating an environment in which there is transparent responsibility and accountability for maintaining standards and by allowing excellence in clinical care to flourish. To put it simply, it is an overarching framework that sets a clear goal for all health service providers to ensure safe delivery of quality care.
That sounds simple enough, but how do we see that applied in our practice?
According to Starry, it involves a few elements: education and training, risk management, openness, research and development, clinical effectiveness, and clinical audit.
Clinical governance ties all health service providers together towards the goal of optimizing patient outcomes. It lays the groundwork for an environment conducive to a more clinically effective teamwork and continuance of care.
Different hospitals and health service providers cater to differing patient populations, which then drives patient interactions and molds a hospital's culture. Clinical leadership then becomes essential as various leadership styles come into play to ensure productivity and efficiency and that goals for patient care are achieved.
We will learn more about various leadership styles a little later.
Leadership in the clinical setting is complex. It is not the usual top to bottom hierarchical leadership structure which can be seen in most organizations.
That's a good point, Angela. In a clinical setting, leadership must also begin at the front line. Every clinician is not only to their chief executives and senior managers, but also to the governing bodies for the care they give.
This is where education and training come in. Continuous education and training opportunities on the best and most recent evidence-based practices are vital for clinicians to have the tools and skills necessary to ensure patient safety. A broader knowledge base and a better understanding will help clinicians have a better handle on risk management. They would know what to look out for and how to prevent problems before they even happen.